of the angiograms.
Wow.
It's not the same quality as if you have the original angiogram, but it's pretty darn close, and for teaching purposes, it's just unbelievable. So all this media can be put right now into our media-rich, whatever electronic site you're putting it on.
Fantastic, fantastic.
And look at you, you got the tiniest video camera on the planet.
This is one of the best HD cameras I've seen.
Yeah.
It's a very new Sony, actually. It's just come out. And but the only thing that is a little bit of a holdback is that it doesn't have internal memory. It's only on a card.
I see, so you have to replace the card if it's a long thing.
Yeah.
So how long?
You get about 250 minutes on one card.
250 minutes, that's everybody at the ACC for 5 minutes.
It's like a 4 gig card. I mean, it's crazy.
Okay.
So anyway,
do we have a script or anything in particular?
Absolutely. Well, particular is what you've been working on with Elsevier.
Okay.
If you have anything new coming out, or if you wanted to talk maybe a little bit about what you've got out there already as far as titles.
So let's talk about that.
Yeah. So and just start with. And you can just keep on looking at me.
Okay.
We do 2 so that we can kind of cut stuff in and out, and we'll put book titles up there too.
Nice. Okay.
We'll edit them in.
So are we ready to go?
Yeah, just give us your name and where you are. Oh, you're from Orange? I grew up in Huntington Beach.
Yeah.
There you go.
So
cool.
My name's Mort Kern. I'm a professor of medicine and director of cardiology at the Long Beach Veterans Administration Hospital in Long Beach, California. Also, associate chief of cardiology at the University of California, Irvine main campus located in Orange at the Hospital Medical Center. I'm an interventional cardiologist and have for many years worked in the cath lab and teach about hemodynamics, teach about coronary physiology, teach about methodologies for treating patients through invasive means mostly. I have particular love of hemodynamics and of cath lab techniques. So I was fortunate to produce a book by Elsevier this year called the Cardiac Catheterization Handbook, which is, to my knowledge, one of the best received books in the subject. It's recently released in its 5th edition at this meeting. It has a beautiful new yellow cover, but it says the Cardiac Cath Handbook. And in it is everything fellows, nurses, residents, practicing cardiologists need to know about how to begin in the cath lab and how to proceed through it, through standard methods, new techniques, and the most widely used methodologies for best outcomes. So this is what we think is a teaching book for the cath lab. As a companion, we're producing this year as well the Interventional Cardiology Catheterization Handbook, which should do the same thing for the specific area of interventional cardiology, that is the placement of stents, the assessment of arteries, the use of the interventional procedures, the good side and the bad sides as well. So these 2 products by Elsevier are a couple of my favorites. I think they've been well received by my students, fellows, colleagues, and they look good. I do have a couple of other books, and last year we produced the 3rd edition of a book called The Hemodynamic Rounds, which is a large collection of hemodynamic tracings of different pathologies, pathophysiology states, all valvular disease, all constrictive, restrictive physiology, all hemodynamics involved with just about everything you can think of. It was a compilation of single reports years ago, and now it became a full textbook two editions ago. So this new edition is increased. It's also well received for the teaching of hemodynamics, kind of a lost art in cardiology, but very important. On a personal level, I did produce a book myself this year, independent publisher, called Notes from the Cardiac Cath Lab Digest, which is a magazine monthly published, and I write an editor's page. So for every month I've had a little freedom to write a topic, and we put those topics over the last 6 years into a single text. It can be found on a website with my name on it, mortonkernmd.com. You can get this book, and you can also access the website for the Elsevier publications as well. And I think the cath lab people have enjoyed discussing and hearing discussions about problems they have in their cath lab on a daily basis. And it's been, again, I think, nicely received. It can be found in the Cath Lab Digest, which is that monthly publication.
You're making this very easy.
Okay, good. Well,
tell me just a little bit about what you see as some of the big upcoming trends or ongoing trends in the industry, and what you think about them.
Okay. So what's new in cardiology? What's coming forward? And from my point of view, and especially with reference to the invasive part of cardiology, It's clear that radial artery catheterization has risen now to a very prominent new methodology for the cath lab. It's an old technique. It's been around for a long time. It's used outside the country widely, 90% of cases, but now the United States has adopted this. And actually, in the cardiac cath handbook, I've reversed the order of teaching so that the radial artery approach takes first prominence, and then the femoral approach, of course. And so this is a new trend, which I think is really going to make a difference for patient care. Second, of course, we're in the very mature era of stent, drug-eluting stents, and in the interventional book we talk about that, but forthcoming will be biodegradable stents. That's a very big advance, and that's something that we'll need to learn about more, but it's certainly in the future. And the third major advance, which I'm sure everybody by now is aware of, is the implantable heart valves. And this is called trans-aortic valve implant, TAVI for short, like in the old days PTCA was for balloon angioplasty. This is for implantable heart valves. And this is a rapidly rising field. At this meeting there were the results of the partner trial where they compare valve implant to surgery. I don't know the results, but my impression was that they were very similar, meaning you could get a heart valve and have the same outcomes with less invasive approach. Big deal. So this is very important. Approaches to other valve disease and structural heart disease is the last area that is really rising fast. So the field is maturing, and it's very exciting to be involved with these structural heart disease changes as well as new technical changes in stenting, of course radial artery catheterization, and maybe last but not least is the physiologic assessment of lesions with fractional flow reserve, of which I've been involved with for a long time. This is a measurement of flow across a stenosis to determine if it needs to be stented. And so unnecessary stenting can be eliminated with this technique, and sometimes you may identify lesions that you would not think need stenting with the fractional flow reserve assessment. And recent data presented just last fall about the 2-year outcome of the FAME trial of fractional flow reserve and angioplasty multivessel evaluation demonstrated that this approach, using FFR to guide your multivessel intervention, produced better outcomes, and they produced them at a lower cost. A very unique result in medicine in general, but specifically in cardiology.
It is very unusual in medicine in general. What about for you? What's coming up for you?
Oh, so for me personally, what's coming up is I'm developing our interventional program at the Long Beach VA, which has not had an interventional program before. So just since January, we've started our stent implantation program, and we did our first structural heart disease PFO closure last Friday. We plan to be doing more of this and ultimately get into our structural heart disease program at the VA. So personally, that's very exciting. On a research basis, I'm looking forward to getting my optical coherence tomography system. I already work with the near-infrared spectroscopy system, which tells me about the content of cholesterol in an artery, invisible to the IVUS and invisible to angiography. So these are the exciting things in my area and for me personally.
Sounds like some technology involved with a lot of that. Is that one of the kind of companion things you're seeing neck and neck with some of the other developments going on? Is it always...
Oh yeah. Well, in interventional cardiology, where I spend most of my time, the technology advances are dramatic, and it's a continual improvement year after year. The industry identifies a problem, works on it, finds new technology to answer the question, develops techniques, we employ the techniques, test the results, and we make advances in this way. I mean, this has been the story of interventional cardiology from the first days of Andreas Grunzig.
What's your thought on ACC so far this year?
I really like the ACC meeting. I mean, this annual meeting provides an opportunity for me not only to come and share information, obtain information, see my colleagues in the area that I work with. The short exchanges in the hallway, maybe among the most valuable interchanges we have on what's new, what's happening, how to do things. The ACC has really improved its creature comforts, which I think is important for a good meeting, but also for the venues, making easy access. You know, I'm feeling very good about the meeting this year. Some years in the past it wasn't so good. This is exceptional.
Excellent. Now you've worked with Elsevier multiple times. What's your assessment of the editorial process, the editors you work with?
So I am on the editorial board of a couple of the JACC journals. They're published by Elsevier. I have done a number of books. I think the editorial process is very effective, highly professional, responsive, and a pleasure to work with. I've really had very timely needs met. I've had my galleys and all my other technical aspects satisfied. I've had really no complaints. Okay, thank you. I got to go to lunch.
That's all we need.
Nice seeing you.
Us